episode of the 2020 podcast, Canada's #1 optometry podcast. I'm your host, Dr. Harveer Sayan. Thank you so much for taking the time to join me, guys. Always so grateful for all the support, liking, sharing, everything that you do. I'm coming to you from the JW Marriott in Vancouver, BC at the BC Doctors of Optometry conference. Again, it is the best conference in all of Canada, bar none, by far. I'm gonna say that every time until you guys all come over here to join us the next conference. But more importantly, trying to elevate our profession and ourselves and how we practice, we are going to be doing a special series of conversations, 4 or 5 interviews, short little segments on the discussion of scope optimization and modernization. And so make sure you look out for these little conversations, because we're gonna come from different angles to talk about this. It's not simply, yes, we should expand scope, all right, and go talk to your MLA. It's more like, why, what can we expect? Who has worked in expanded scope roles? And why would it be advantageous for us across Canada to modernize our scope? And there's no better person to have this conversation with than my friend, Dr. Cedrick Mah, who is a graduate of the University of Waterloo in 2022. He did his residency training in ocular disease and low vision in Oklahoma. He is a fellow of the Academy of Optometry, a Diplomate of the American Board of Optometry, and just newly crowned Young Optometrist of the Year by the BCDO. So definitely a special guest. Thank you for joining me, Cedrick. I appreciate it.
Thank you, Harveer, for the invite. I've always been a fan of the podcast, so it's kind of crazy to be sitting here right now, but super excited to talk about scope and talk about the opportunities that are available.
Opportunity is a good word. Opportunity is a good word. So the reasons I said I think you're a great person to speak to on this is because you've actually had the exposure of practicing at an advanced level and with advanced procedures. So you can share with us what was the experience like, but what was the advantage of practicing at that level? What are the benefits of that? Keep that in mind, that Cedrick's practiced in Oklahoma and had all this experience, right? Lasers, advanced procedures, ordering imaging tests and blood work and all this thing right from his exam room. Taking that in mind, right now, practicing in Vancouver, where you are, at Mount Pleasant Optometry, as you can see. Have you recently had the experience where you've had a patient when there's a condition that you felt you could have managed, but were not able to manage because we practice here in BC?
Yeah, flat answer, absolutely. And I think it happens every day, and I don't think it's a new issue. And I think it's a shared issue amongst a lot of us, right? Even if we're not residency trained or, practicing in the States, it's definitely something that I think we all experience for sure, and definitely, ultimately, the patients are the ones that kind of suffer. And that comes in ways of delay of care, right? Healthcare redundancies as well, and reduced access, right? So I think about my glaucoma patients a lot when I was in residency with, laser privileges. If I had a patient that was, I diagnosed with glaucoma, we wanted to initiate first-line treatments, could get them right in for an SLT, 1 week later. And it was just such an easy conversation for them and easy for them to understand what we were able to do. And while that initiative is still great here in Vancouver and all of us want to provide that, there's obviously legislative barriers that don't allow us to do that, right? Yeah. So I think of a patient I literally had last week. We were doing an entire glaucoma workup. We were able to see progression, and I wanted to start her on hypotensives. We did, but there wasn't a good response, right? There wasn't a good IOP lowering response. So our next step is SLT. And then I say, okay, here's a treatment we can do. We already did gonio. It's similar to that. And she's like, when can we do it? Well, unfortunately, I'm gonna have to refer you to a specialist. And the conversation goes, why? We've been working together for the last year, right? And I just have to tell them, there's certain barriers present in, where I practice currently in Vancouver. If we were elsewhere, be totally happy to help you with that. But unfortunately, there's this certain limitation that we have, right? Yeah. And I think getting patients in on that conversation as well, making sure that they're aware of that, is also something that kind of helps push our agenda forward.
Yeah, well, I think you've already kind of talked about it, but what are the frustrations that you're encountering? Like, of course, this was a perfect example, the glaucoma patient, but in general, day to day, you're encountering with the fact that we have these limitations on our scope right now.
I think it causes a lot of confusion for patients as well, right? Because we're seen as the primary eye care provider. So it's like, why are we not able to provide the fullest scope to our teaching, right, and of our practice? So I think patients are confused then, and then it adds a whole barrier about delay of care, referring to the specialist, and then you don't know the backlog that they're dealing with. And then it just obviously causes a lot of these redundancies in the healthcare system. And I think the biggest proponent that suffers is going to be sure.
Absolutely. And in your experience then in Oklahoma, you found that having the extended scope, being able to practice at that scope, it was more efficient it provided, that ultimately resulted in better patient care.
Absolutely, because you were able to see these patients that came in and you were able to kind of investigate for further indications or further or request further testing to understand the diagnosis, right?
Yeah.
And you're able to do that yourself. You're able to kind of order the blood work, order extra imaging, and then loop in the primary care provider in that conversation. But ultimately, having the ability to do that just expedited and also made it a lot more efficient to provide that care for the patient. So there's countless examples where even if I had a patient that came in without a care provider, I could say, oh, you know what, I think we need this lab work to be done. Yeah. We're going to order that. I'm going to refer you to the walk-in clinic there. They're going to set you up with a healthcare provider there. And then it was just a seamless transition, you know, and obviously there's other, you know, concerns, right? But in that way, just that different practice modality was definitely something that I think could be implemented here as well. But unfortunately, legislation doesn't bar us to do that, right?
Certainly seems like that would streamline a lot of the processes, like you said, reduce redundancies, and I imagine reduce costs for the government as well, right?
Yeah.
If we're not having to duplicate multiple things or have them specifically go to an ophthalmologist to have certain tests done.
Certain tests that can be done very easily with optometrists here. Yeah,
absolutely. So what do you think, knowing what you know, practice at the level that you've practiced, what do you want to say as far as to our colleagues here in BC and across Canada, you know, wondering if it's important to modernize our scope, and then B, what do we want to encourage them to do to help move that forward?
Yeah, and I think modernize is a perfect word for this, right? Because legislatively, yes, we're expanding scope, but we've all been taught all of this stuff in school, right? Bringing the care that we can to our patients to the level at which we're taught. And something that I really think about is, you know, we are kind of the experts in eye care, right? We know about the visual system, you know, perception, all of that. So when we tell our patients, if you have concerns, we are the experts in that. But we're also experts in optometry, right? The profession itself.
What is optometry?
Exactly. What is optometry? Right. We're the only ones that can really elucidate that because we're optometrists.
Yeah.
Right. So when we have conversations then about scope modernization, no one's going to advocate on our behalf except us, right? We're the experts in that domain. So we have to, I think the onus is on us to also educate our patients as well on what we can do and what we can provide.
Absolutely.
Right? Because garnering that public support, helping them understand those limitations that are legislated at this stage, you know, will bring in that movement, I think, a little bit more.
Yeah. I think you said something earlier about using each opportunity with a patient.
Yeah,
and I think that's really important.
Yeah, every patient interaction, I think, is an opportunity to go into that discussion. Like a red eye comes into the clinic and I say, yeah, like tell me what's been going on. Well, I went to the ER 2 weeks ago and then they gave me this, and then I went to my primary care provider and then they did this, and it's still irritated. And I'm like, okay, that's great, diagnosed, whatever. Here's some eye drops. You know, next time we're always available to help you out. You know, if you have any concerns, we can handle all of that. We can prescribe the medication as well. If you have any members in your family that have concerns about the eyes, you know, we're here to help you with that. Right. So taking those opportunities to tell them that, because a lot of the time they don't know, right?
Yeah, of course.
They're not aware of that. So
absolutely. I think that's a really great point, is take every opportunity you have to educate our patients and potential patients about what optometry actually is and what we do. We're medical professionals, we're primary eye care, primary health providers for the eyes specifically. So if you have a red eye or itchy eye or whatever, don't go to the walk-in, don't go to your family doctor, don't go to the ER.
I mean, it's great that they can help out in that regard, right? But it's like, we have the tools to really look into that and tell you, this is what you have, this is where you can go to get further care. Because if they're with their PCP, I mean, you know, the healthcare dollars, right? They're getting misdiagnosed or, you know, different treatment options, right? So that's going to be just a delay again.
So how many times was that patient billed for a visit?
Yeah,
and how many different places, right? Again, going back to the burden on the healthcare system.
Exactly, yeah.
No, that's a great point. That's a great point. Anything else you want to share before we wrap up?
I personally, you know, scope is my thing that I'm very passionate about. I think it's great to have different perspectives in optometry and where people have practiced, both provincially, both nationally as well. But I think something that really hinders our profession is kind of complacency as well. I like to think that complacency is the barrier to success a lot of the times. And, you know, what's unfortunate is that, you know, when we're students and we're learning about the profession, we're learning all that, we can blame it on, you know, well, we're not working. We don't really know yet, right? But we're working professionals now. I think we all fully understand like what the profession could be, but a lot of the times we're still just kind of lying back and we're just kind of being comfortable where we are. But think about where we were like 20 years ago without even dilating drops, right? Or like TPAs. It's really crazy to think how we can even manage, ocular care before. But, we had people that were pushing for that for sure. And I think now we take it for advantage a lot of the times. But similar to this, right? If we want to move that forward, we have to be in the driver's seat,
right?
And we have to be part of those conversations with patients, with other healthcare providers, right? And we have to push that agenda, basically.
Yeah, absolutely. I think that's a really great point. Complacency really is a barrier to success in all forms. Certainly in this case, if we get too comfortable with our current scope, nobody's going to be advocating or pushing for it unless we do. So thanks again, Sed. I really appreciate you bringing your insight into this conversation. We want to really try to bring different perspectives to have this conversation, because otherwise I know it kind of sounds like the same, we're beating the same drum over and over here. But speaking with somebody like Cedrick, who's got experience practicing at this elevated scope, practicing with these advanced procedures, helps us understand the benefits for us in our practice, our profession, and ultimately to serve our patients better. So, if you're interested in learning more about scope, reach out to your provincial association, the CAO, and wherever. And I know there's going to be a lot of resources out there. Once again, thank you, Ced.
Thank you.
Thank you to the BCDO for providing us with this forum here at the JW Marriott, the space here to record. And thank you to everybody for listening and watching the 2020 podcast, Canada's #1 optometry podcast. I'll see you soon.